Question remains, will parents take their young kids to get the shots? Studies show parents' concerns are high. Ben Jordan goes 360 to hear from a variety of perspectives.
Pharmacies across Wisconsin will soon welcome kids ages 5 to 11 to roll up their sleeves for a child-sized COVID vaccination. The new age group essentially means all school-age children will be eligible. But a new national survey found more than half of all parents are still on the fence. The wait is almost over for kindergartners through 6th graders who want an extra layer of protection against COVID. But the decision comes with plenty of hesitancy for their parents who are required to offer their consent in Wisconsin. Let's go 360 to hear from a parent who wants to wait it out, another parent who already got her daughter vaccinated, an organization representing Wisconsin school teachers, and the leader of a health system's pediatric COVID vaccine trials. Bridget Roming has an 8-year-old daughter and an 11-year-old son. She says she and her husband waited several months after they were eligible to get vaccinated, and she's even more hesitant about vaccinating her children.
I'm Mama Bear. It's my job to protect them, and that's what I'm going to do, regardless of what anybody else says.
Bridget says her biggest concern for her kids are side effects and potential long-term effects. The COVID States Project surveyed more than 20,000 parents across all 50 states on this issue in September. 65% of those parents said long-term health effects was a major concern.
I just have to see more data. Once it's actually been implemented and they've had some more testing and a little bit more detail, and actually talking to my pediatrician.
Karen Kordrachi says she and her 13-year-old daughter got vaccinated as soon as they became eligible.
My mother-in-law suffered from polio when the epidemic broke out, and she had lasting effects for years and died early because of post-polio. And so we take this seriously.
A team of researchers from Harvard, Northeastern, Northwestern, and Rutgers found the likelihood of parents vaccinating their children is highly related to their own vaccination status. 78% of vaccinated parents say it would be extremely or somewhat likely that their kids would get vaccinated. Meanwhile, 58% of unvaccinated parents say it's somewhat or extremely unlikely that they would vaccinate their kids.
For me, it was an easy choice. I thought that I was protecting her, I was protecting her friends, I was protecting family. But I understand people's concerns.
Wisconsin Department of Health Services data shows no one in the state 9 years old or younger has died from coronavirus complications. However, nearly 600 have been hospitalized.
15. Yes, 15.
The Wisconsin Education Association Council represents teachers and school support staff across the state. President Peggy Wirtz Olson says getting 5 to 11-year-olds vaccinated will result in fewer elementary school outbreaks.
It's a tremendous opportunity. We've been clear all along about that importance of having these safe and healthy schools. So I think this is a real opportunity to be able to continue that in-person learning with less disruption.
The council says now is a great time for parents to talk with their family physicians about getting their children vaccinated. Dr. William Hartman is UW Health's principal investigator on pediatric COVID vaccine trials.
Pfizer's trial is focused on their pediatric dose, or 1/3 of their adult dose. Its efficacy and safety in this age group, the 5 to 11-year-olds. And they found that it was about 90% effective in preventing COVID-19. So in their vaccine group, they had 3 cases of COVID. In their unvaccinated group, they had 16.
Dr. Hartman says the medical community is concerned about parental vaccine hesitancy and how it could prolong the pandemic. But he says there's no need to fear long-term health effects for your child or yourself.
We have not detected, even in the billions of people that have been vaccinated worldwide at this point, any long-term effects from these vaccines in the over a year now that they've been administered to people.
Dr. Hartman says kids in this age group may get a sore arm or a fever, but those symptoms typically go away within 24 hours. Reporting in Shorewood, Ben Jordan, TMJ4 News.